Mr. Knuuttila, 8 years ago, the people of Massachusetts approved a referendum rolling back the income tax rate from 5.85% to 5%. In 2002, the legislature stopped the rollback at 5.3%, where the rate sits now. Did the voters make a mistake in 2000, or should the tax rate be reset at 5%? Why?
I'll put it to the listening audience. In the relatively tough fiscal times that we find ourselves in, would that be a responsible thing to do, to go back to 5%? Would that be a responsible thing to do in the tough fiscal times that the Commonwealth currently finds itself in? My knee-jerk reaction would be no. But, listen, I'm not for turning the Commonwealth of Massachusetts into one big town meeting. I know we're a republic, and you elect your representatives, senators and representatives, to go to Boston to represent your interest. And through them, your interests are supposed to be adhered to. But these issues that the people tell us to do need to be looked at seriously. They've told us to do certain things, and we should do them. Now, my knee-jerk reaction, as I said, would be something along the lines that maybe I wouldn't do it initially. I'll tell you, I'm torn on this issue because we are in tough fiscal times. But the people told us what to do, and I'm probably, and I'm not probably, I would support that issue.
Thank you. Representative Flanagan, your question.
I think that the voters have their voices spoken every day. Every day that they talk to their elected officials, whether it be a local elected official, a state elected official, a federal elected official's office, people talk about what's important to them. I think part of the reason that people often say, you never hear us or you never pay attention to what we want, is that there's constantly dual messages going through. There's usually the message saying, we want you to roll back your taxes, you're going to put more money in your pocket, and then there's the other message saying, if we roll back your taxes, you're going to have less services in the state. That's all very true. I don't think the people made a mistake when they asked to have their taxes rolled back, because certainly people want more money in their pockets. But I also know that when people walk into my office asking for services, they tell me they would rather have their senior citizens have pharmacy programs than have an extra $100 in their pocket. I think you have to look at it from the time that the vote was taken and also look at it now. We're facing a question on the ballot that's going to, eliminate the income tax. People don't understand that if they do that, that's over a quarter of our state budget. That's many of the services that we're talking about here today: transportation, education, preserving conservation land. We as legislators need to tackle that issue, but we also need to do it in a fair and rational manner. People want to have their taxes rolled back. If that's the decision that they make, then that decision is going to have some serious consequences on Beacon Hill, and at that time the legislature is going to have to deal with that.
Thank you. Representative Flanagan, 2 years ago, you supported the state's universal health care bill. Are you happy with the way the program is working? If so, why? If not, what would you change?
Health care reform is very important to me. I think everybody is entitled and deserves health care, preventative health care. I think that it's important that we look at where people were getting their health care at the time. And, a lot of people were using our emergency rooms as their doctor's offices. A lot of people were not getting the preventative care that they need. They were at crisis point by the time they entered the healthcare system. I think for the first time this program is working to an extent. I think that the number of people that have signed up for health care is certainly exceeded our expectations, but I also think that there are some bugs that we can work out. I think that we need to streamline the documentation process. I think we need to look at how much insurance companies are charging for premiums. I think we need to look at the problems that we have with the lack of primary care physicians in this state. If you take a look at UMass Medical, we're not graduating many primary care physicians. That doesn't help someone who's trying to go in and access health care if you have to wait 6 and 8 months in order to get a doctor's appointment. I think that we also can take a look at President Murray's legislation that's going to streamline electronic documentation. We need to look at where exactly people are coming and how we're going. It's too early to tell exactly what's going to happen with this. And I think it's a work in progress, and it's something that the entire country is looking at Massachusetts for.
Thank you. Mr. Knuuttila, same question to you.
There's a couple of issues that, quite frankly, I've gotten from individuals who live in Westminster and Ashby that I think bring light to some of the shortfalls of what you're referring to as the Commonwealth Connector. And people have already lost their individual tax deduction on their income tax filings as a result of not having an insurance plan in place. They are going to also be penalized by the end of this year for additional monies, I believe to the tune of $1,500, if they don't have, by the end of the year, a health care plan in place. That's the penalty. That's the stick that's being brought down on the heads of individuals that have been looking for this, have been looking for viable health care plans, but have been unable to either afford or attain a good health care plan for themselves, their wife, or their families. And the reason for that is because drawing down the uncompensated care pool that we normally allocate for uncompensated care or providing care for those people that don't have health insurance, that's being used to fuel this program. And other financial, unspecific revenue streams are being used to finance. There's a need for some serious tweaking of this program because there's not a dedicated revenue stream for this particular program. And that's what I think is the principal problem. You have to have a dedicated revenue stream for this because it's an enormous undertaking.
Thank you.